consulting room which is definitely not on, and having a sense of humor, taking things in a little lighter vein, because we need to understand why is it necessary to have some amount of speaking skills and a sense of humor. Patients come to you, especially in a tertiary practice like mine, who have been frightened by another eye surgeon. Either they've been told that they've got a cataract, which by evening today, if we don't operate by tomorrow morning, I can't guarantee vision. Or they are in fear of what you're going to tell them. They can't see well and you're going to tell them that there's an incurable cancer in the eye or something like that. These are the thoughts that are in their mind. So they need to be put at ease. Once they're at ease, they'll be more receptive to what you're saying. Otherwise, they're just so scared sometimes that they're not following. And in your initial stage of practice, your speaking abilities is what is going to set you apart from your competitor who is next door to you. 25 years in practice, you're just starting practice. What do you have that that person doesn't have? Is your ability to communicate, perhaps with a little bit of humor. Later on, your surgical skills will become known and they will say that fellow very bad-tempered doctor, but what to do? He does cataract so well, I'm going to him. So that is later on. But in the initial stages, when you're starting practice, if your communication skills are great, it'll help. My biggest competitor was my father, because my father was an eye surgeon in the same clinic with the same waiting room sharing. So it was impossible to compete with him. But the secretary was the person that I had bribed. She had been with him for 30 years and she was very sympathetic to this youngster who came in. So you tell the patient, what do you have? You have you come for chashme ka number, spectacles, you're 40 plus, you know, presbyopic glasses. Dr. B.T. Maskati will spend precisely 3 minutes with you because he's got so many patients. Dr. Quresh Maskati, on the other hand, will spend 30 minutes to find your correct glasses number. So the patients were diverted to somebody who had 30 minutes of time for every presbyope who walked in, because there was no other patient following. So what do I do in those 30 minutes? In those 30 minutes, I am communicating with the patient, trying to wean that patient away from this Bhishma Pitama person sitting on the other side. So it's your speaking abilities that you need to develop. Your surgical abilities you've already developed in whatever medical college or postgraduate course you've undertaken. So what is communication skills? You explain in language that they understand. So typical thing is the eye is like a camera, and then I tell them that not the camera that you know, but in our days, and then I point to my white beard, we had a camera which actually had a film at the back and which actually had a lens in the middle and things like that. So then they smile about it. And if it's somebody who's 50 plus, he says, yes, doc, even I have used such cameras. So then you're already with them on that. So then you can use models of the eyes or color atlas of the eye, or if you're computer savvy, you can show on your computer screen the model of the eye and take away the front and back and whatever. So don't tell jokes to patient. For heaven's sake, don't do that. Whatever the provocation, you have all the time, patient have all the time, don't spend it in telling jokes, but just be subtle in the humor. Let's take a few practical scenarios. Cataract, patient asks, doctor, is my cataract ready for surgery? Typical question. You don't know whether he's been to Dr. XYZ who's told them it is to be operated in 15 minutes. You don't know whether you're the first person, because he doesn't reveal this. Is my cataract ready for surgery? Well, you do have a cataract, and it depends on where you place yourself. If you're Mukesh Ambani and you have to sign $1 million checks and your signature differs slightly, you will cause the nation a lot of harm if your signature differs. So if you're Mukesh Ambani, I would probably operate you by today evening. However, if you're somebody who's not interested in TV, or you just want to read the big letters of the Bhagavad Gita, maybe you come to me when you're 95 years of age and we'll think about cataract surgery. So again, you're covering your base. You're telling them that everything is possible. I can operate you tomorrow, or I can operate you after another 20 years, which is true for most of the cataracts. So you're not downgrading a colleague at the same time because you don't know what he has been told. Then, doctor, you'll be doing my surgery by laser, no? Because he's heard laser everywhere. Now, only 1% of the people even in Mumbai would do it by laser, the femto. But 99% of them will tell them. So I tell them that I will be doing it by laser, what people call laser, which is not exactly laser, but it is using a machine to remove your cataract. But because no stitches are taken, people call it laser. It's difficult, phacoemulsification, very big word. Laser, small word, people understand. So I tell them all this. So I'm covering myself, I'm not lying to them. And doctor, which IOL is the best for my eyes? So I tell them that if you go to a restaurant and ask for kali dal or yellow dal, you know the difference. Even if one dal is 100 and one is 150, you will go for the one which you like because you're the expert. Are you the expert if I tell you that there are 5 lenses which I use, one is 100 rupees, one is 500, one is 5,000? You're not the expert. So leave it to me. I will choose the IOL which is best for your eye. Because even if I give you a choice, you won't be able to. I don't have a counselor. I do my own counseling. So I never tell them which. I just tell them there are 2 types of IOLs. One is what is called multifocal and one is what is called unifocal. So I tell them the basic difference between the two. Between them, what brand to use? 95% of my patients have no clue what IOL I've put in till the sticker is given to them at the end of the surgery. 5% of them will come with because of Alcon advertising and say, doctor, you will put Alcon? Only Alcon comes with advertising. So I say, yes, I will put. Then I put an Alcon because they've come with preconceived notions that only Alcon makes lenses. But for the other 95%, the choice is mine depending on the budget. That budget is always negotiable. So I tell the patient that you for my cataract surgery, you have to pay 50,000. He says, no, I cannot pay so much. I said, all right, we'll do it in 30,000 or 20,000 or whatever. That's my, and I tell them, don't worry, but the IOL will be the best possible for your eye. So in my mind, I've already downgraded the IOL which I'm going to use, but I haven't discussed that with them. You'll use only drops anesthesia, because he's heard somebody doing phaco by topical. I am unfortunately not a topical person, never use topical drops. So if you are like me and you never use, I tell them, look, there is a choice. If you want, I can do it under topical anesthesia. But the problem is that my heart rate tends to go up when I do it. And I found that every time I have to tell you, please look in the light, don't move your eye, don't move your eye. Like that. So this is the volumes that I use. And then it's very easy for me to blame you if something goes wrong because you have not cooperated. Here, why don't you let me take the blame for something going wrong? By operating you under anesthesia, so you will not be able to move your eye, so you cannot disturb me in my surgery. So that appeals to them. You might use a different dialogue altogether if you are actually doing topical, but for people like me who are not, this is what I use. And then you guarantee I won't need glasses after surgery. So you guarantee, doctor, because he's heard this, that everywhere no glasses are required. I said, no. The point is that everybody has to make money. The eye drops people have to make money. The spectacle shop owners have to make money. Everybody has to make money. So it's a group practice that I'm following. So you cannot expect me not to give you glasses. But the choice will be yours. I mean, to wear the glasses or not to wear the glasses, your choice. I will definitely prescribe glasses after surgery. But sometimes the number is so small, many of my patients refuse to wear those glasses. Choice is yours. But I will prescribe. So I am using sense of humor. I am not lying to them, but I am covering my backside so that tomorrow if I give them a minus 1.5, I can say I told you about it. In glaucoma patients, doctor, I find it difficult to remember to put my eye drops. It's okay, na? Once in a while I forget. I said, yeah, once in a while you forget is perfectly all right, but if once in a while is alternate days, then it may not work because glaucoma is a slow progressing disease. But you're really tempting fate by not putting the drops. And then what to do? If you persistently are not compliant, I might have to operate you with all the hassles of surgery. Then you tell them about glaucoma being a one-way street. So doctor, will I go blind or when will I go blind? So you tell them that you stay with me, I will see to it that you never go blind. Because if you caught a glaucoma, there is chances are, unless he's got 0.99 cupping, and disc pallor or something, chances are that at least you'll be able to preserve whatever vision he has. So you tell them, I'll preserve your vision, you won't go blind, but please follow my advice. And if I do surgery, will it cure my glaucoma? I said, I wish we could say such things, but there is no such thing as cure. What we'll do is, we'll eliminate the need for multiple drops. It is even possible that after the surgery, you may not have to put any drops. It's possible. So I'm again covering my back by saying that it's not 100% that after a trabeculectomy you won't need drops, because glaucoma tends to progress, I tell them. So you may not need drops immediately, but glaucoma may slowly progress and maybe you'll need a drop or so. Will my surgery for glaucoma result in cataract? Again, he's gone to Google, he searched this out, he already knows. When somebody asks me, will my surgery for glaucoma result in cataract, means he knows that it will result. So I tell them, look, cataract is something which is an age-related process. So in course of time, you may or may not, but most likely you will develop cataract. If I have done a glaucoma surgery, You will probably blame the glaucoma surgery. Who knows whether it's my surgery or your age itself which has progressed, which will cause the cataract. So you put that doubt. It's not that my surgery is going to cause. And can you restore vision in my left eye which is blind due to glaucoma? So then you tell them about, I wish doctors were really gods and we could resurrect the dead. But the last time that happened was 2000 years ago, when a gentleman in Jerusalem got up and walked 3 days after his burial. It doesn't happen otherwise in day-to-day life. So using a little bit of humor to tell them this. So use humor in all situations. Why have I got the diabetic retinopathy? My sugar has been under control for, he's accusing you that my sugar I kept under control. You're allowing diabetic retinopathy to go on. What nonsense. So you tell them that, look, if your sugar had not been under control, 10 years ago you would have got the diabetic retinopathy. Congratulations, you have been able to survive 20 years. The statistics are that 15 years, diabetic for 15 years with excellent control, 50% will get it. But you survive 20 years because excellent control. Continue with that and look after the diabetic retinopathy, but keep your sugar under control. You give capsules just because the medical reps have told you about all these antioxidant magic cures, and every patient of diabetic retinopathy or ARMD is given some antioxidant capsule. Some of them are expensive, most of them are expensive. So will these capsules cure my ARMD? I said no, but the pharmacy companies also have to survive. So we need to give you these capsules. So they're already laughing with you, and they already know that that's not the truth. You're actually giving it for their own eyes. But you've told them this, so then even if you take a fancy ball pen from the pharma company, it's all right. Doctor, what about homeopathy or Ayurveda? Or magnetotherapy or whatever, urine therapy. I've heard that that's the treatment of choice for retinitis pigmentosa or for whatever. So you say, look, I'm not qualified. I'm unfortunate. I've done only allopathy because it took 10 years just to learn a little bit about ophthalmology to come to you. And those people over there are so much more experienced in this than me. So I cannot do anything for you as far as I'm just trying to maintain your vision. But if they promise you something, please go ahead. So let them go. Tell them to go for a disease which has no cure. Tell them to go. But then tell them that, look, I don't know about it. Ask him uncomfortable questions. Please ask uncomfortable questions to the guy you're going to for urine therapy or magnetotherapy and see if he can give you convincing answers. How do I get rid of my floaters? I said, I have 4 or 5 of them myself. The moment I discover, I'll give you a phone call. So again, it's telling them that these are things which you have to live with. I am living with them. And I tell them that, look, sometimes my wife stands in front of me and is lecturing to me, and I didn't even realize she'd been there for 15 minutes. I said, if I can ignore a 5'6" lady for 15 minutes without even realizing, I said, what are these little floaters? Just learn to get rid of them by not seeing them. So what the mind doesn't see, forget about it. Why is retinal detachment surgery urgent? Why can't I do it after? I have to travel tomorrow. I'm going to London, Paris, Zurich. I'll come back after 3 months and then do retinal detachment. By all means, I tell them, do it after 3 months or so. I will charge you more and the results will be less, but it's your choice. So you need to use this. So just pretend to be a patient of any disease and use humor every time. And my replies that I gave you just now are not the only possible way to answer the question. It's only meant to get you, don't get annoyed with the patient, don't get defensive or irritated when he tells you, I want to go to a magnetotherapy specialist. Or don't get irritated, take it with humor, and the patient tends to remain yours. Smile when they come in and smile when you say thank you to them. After all, they are the ones who are seeing to it that you have dinner on the table at night. Thank you.
Of the old problem also, there's an opportunity now. So probably by just changing the lens to a different lens, which is going to solve the second problem also, we can get rid of the first problem. See that you can see clearly for distance always. I think this has always worked. Because normally what happens is, like you say, you have an astigmatism